All right, so let's take a little look at how acupuncture can actually help with low back pain. So to date, we've already got tons of research on this. I mean, from all over the world, United States, China, France, Germany. I mean, there's research everywhere, and there's large-scale clinical trials showing tens or hundreds of thousands of people receiving great benefit from acupuncture as a treatment for low back pain. So the benefit here is that this modern research is also giving us further clinical insights into how we can make this practice even better. So let's take a little bit of a look at that. So how can it help? The first thing that we need to look at is we need to start assessing what the cause of the problem is. Is it a trauma, which honestly counts for a fairly small amount of the people that come in, direct trauma. Repeat injuries is by far the most common cause of low back pain. And this really means, work-related injuries, people bending down and picking things up over and over again, or twisting injuries. These are basically micro injuries occurring over and over and over again until finally, something happens and then it suddenly gets worse. But it's been a problem building for a long time. This could also look like, sitting at a desk. For your job, you get stressed, muscles tighten up, you're not moving around enough, so things become more and more stiff, but then you get up and you want to go exercise, do CrossFit, or you want to go pick something up, help somebody with something, and muscles are not firing well, they're not warmed up, and this causes injuries, or even just, again, repeat injuries, from doing this day in and day out. There can be internal issues like menstrual problems, endometriosis could be a player here. We could be dealing with things like kidney stones. That does sometimes happen where you get kidney stones, and that's actually the cause of the low back pain. And then there are inflammatory issues such as bladder issues, interstitial cystitis, which causes inflammation, can actually present sometimes more as a back issue than an actual bladder issue. There could be autoimmune-like conditions like ankylosing spondylitis, polymyalgia rheumatica, which are actually causing inflammation, which is leading to the back problem. So we first need to start there, figure out what's going on so we know how to proceed with treatment. Next, we need to assess the body. We need to start with something that we call an XTOR scan. This is where we assess muscles that support the back to make sure that they are firing properly. This is pivotally important. If you have muscles that aren't firing well, if they're not supporting the back, it's just a matter of time before you're going to have some kind of an injury. Let me give you an example of this. So we've got, these lateral abdominal muscles over on the side here, big muscles, obliques, transverse abdominis. These directly support the back. Lo and behold, in virtually 100% of people with low back pain, either acute or chronic, these muscles are inhibited. That means they're not firing well. It means they're functioning probably below about 50%. And what causes this? It could be pain that causes it. It can be an injury that causes it. It can be changes in the joint itself that will cause this. So now you've got these big muscles that are supposed to support the back, and now you're going to pick things up. You're going to use your back, and now other muscles are taking the strain of that in ways that they're not supposed to. Or the impact of these things, of seemingly normal movements, are now going into the joints, creating inflammation. This is a very big deal and something that has to be addressed. This is where we're going to find chronic pain, chronic muscle problems, disc problems. Okay, so first step, get those muscles firing and supporting the low back again. We do this easily. It's with acupuncture and a little bit of stimulation at very specific spots. Make the muscle jump a little bit, and then we can retest them to make sure that these muscles are once again firing, aka supporting the back. So beyond that, next, we're going to start to test for sensitization, right? So when you have a pain, you get this signal that says, ouch. Let's say that you rolled your ankle. So you've rolled your ankle. There's a sprain strain going on there. It becomes red, inflamed, swollen. And not only does that part hurt, but now the surrounding tissues start to hurt more and more. Your foot starts to hurt. Your calf starts to hurt. This is called peripheral sensitization. Now you're getting more ouch signals that are traveling up your spine into your brain. And these amplify. So the more ouch signals you have, the more amplification that will occur and the more sensitivity you'll have. Now, if this issue doesn't get treated appropriately and timely enough, it becomes a chronic issue and you keep getting these pain signals traveling up into the brain. And now the brain becomes more sensitive to this. And we end up with broad-based sensitivity. That means you become sensitive to all kinds of stimuli that might not have been painful or noxious before. And you can start to end up with chronic pains in other areas of the body as well, because now you're sensitized to it. This is called central sensitization. It's an issue that actually occurs with the brain that may have started with your ankle or with your lower back. Now, this is a very important thing to assess for, because if you come in with low back pain and you've got this central sensitization, it's very possible that a direct therapy to the back might actually make the problem worse, because you're already so sensitive. So you could have massage or chiropractic, doing some exercise, acupuncture, whatever it is, might be perceived by your brain as a noxious stimuli, which makes this problem worse. So this is probably why a lot of surgeries fail. You get these people with chronic low back pain, it gets worse and worse and worse. Of course, we've got an MRI that maybe shows a disc problem, and we can't necessarily determine that that's actually causing the pain. So they go in surgically and deal with this, but we didn't address central sensitization. So now you've created a greater out signal, you've created more inflammation, aka via the surgery, and it perpetuates this central sensitization. This is why we've got research showing such a huge number of these surgeries fail. So what do we do about it? In treatments like this, we can't start localized. We can't start necessarily with checking for motor inhibition, because this is so sensitive that everything's going to start to look inhibited. So we begin by addressing the nervous system. We use acupuncture and stimulation to promote a parasympathetic state. We can actually calm the nervous system down, which will in effect start to calm the pain signal down. So you start to relax more. The pain signals start to calm down. Pain starts to go down. We can also use distal acupuncture methods, which means acupuncture methods that are nowhere close to the area of the pain, but can often produce almost immediate results with the pain. So they can come in, you can be in a lot of pain. Maybe we can't touch the area just yet, but we can calm down that pain signal so that you feel better. You can start moving again. Now, once this pain signal starts to stay down, the nervous system starts to calm down more, then we can proceed with things like addressing motor inhibition and addressing soft tissue involvement so that we can have a more complete result without causing a further problem.